Best of 2020 YouTube videos for Dr. Nail Nipper. Number 2.
How can you tell how much of this to cut off?
Well, you know, some of it is feel, but some of it also is that when I wet it down like this.
That's good.
Yeah, I'm gonna have you just kind of relax here. Better. Okay. So when I wet it down, the callus tissue is like a translucent yellow. And then you can see, like right in the middle there, underneath, you can see some good pink tissue right there.
Yeah.
So when we get to the good pink tissue, that's when we stop.
Ah.
Even experienced doctors will cause some bleeding from time to time. So now we did an MRI and found out that this was a big pile of gout
That's
stuff
correct.
under there, right?
Yes.
Okay. So what we're doing is we're just going to trim this down for you for comfort.
Yes.
Okay. So you watch and let me know if I pull you out of the frame.
So what do you think makes it hurt?
Well, it's a pressure point, so it is
Yeah.
like walking on a big rock in your shoe.
Oh.
And so you know, how could this not hurt?
I guess that's true.
You know.
Oh.
You know, and if we have to at some point, we'll go in and we'll clean out all the gout that's in there.
Yeah.
Now you're on medication now? Or-
Yes.
Okay, so you did go work with your doctor?
I did.
After we
Yes.
found all this? Okay.
Yes.
And we had previously taken a nodule out of the same foot back in the heel, correct?
It was the left foot for the heel,
Okay,
but we also did the right foot, but on top.
okay.
Yeah.
And that came back as gout also?
Yes.
Okay. So good, so now you're on medications and hopefully you won't be building up any more of the gouty tophus, is what it's called.
Yeah.
And when you see it, there's no mistaking it, it looks like this. It looks like wet chalk, wet, watery, chalky kind of material. And sometimes we go in to do surgery and you look at it and you go, wow, I didn't even know this patient had all this gout in their toe joint or something.
Yeah.
And they didn't either, but then we have to talk about it and do some lab work. and-
Yeah.
So, how long has this one nodule been here? What'd you say?
Maybe 3 years.
Okay.
It's been a while.
And has it gotten bigger or pretty much stayed the same?
It stayed the same.
Okay.
At first, it just seemed like a callus.
Uh-huh. And this is a very common place to get a callus.
Yeah. But then we did the MRI and.
Correct.
Yeah.
Okay, so now when I take that same little alcohol wipe and I go over this, now you can see all the normal skin lines in there and all that yellow translucent stuff is gone.
Oh, wow.
So that's all good skin and you can see the fingerprint lines there. Let me,
So then there's still a bump there.
there's still a nodule of the gouty stuff in there.
And wow, that's interesting.
Yeah, and there. So now you can see
Yeah.
that when I wet it down, you can see that
It looks.
there's a lot of like the skin lines you can
Right,
see.
right,
So
right,
that's the
right.
normal skin. Now just to make it look nice, let me make sure I get that piece off. Okay, great. All right, and then the other thing that we can do is to put a little pad on it, kind of like this. Now we put this underneath your orthotic.
Right.
But if we put a pad like this around it, and we have some that are gel and they're reusable, But this will help take the pressure off of that spot right there.
Okay.
And take up the pressure around it so that you don't have the ground pushing right on that.
Perfect.
Okay?
All right, thank you.
Thank you for letting us film.